laparoscopic divarication repair is an emerging technique that has been involved in order to help patients that they have experienced this condition. Divarication used to be considered purely as a cosmetic problem, which it can be, a severe cosmetic and functional problem. But we recognize this condition more and more nowadays as more of a functional problem, because patients with these conditions, they cannot, they don't have appropriate control of their abdominal wall muscles. They cannot engage properly with their abdominal core muscles. And as a result, they get symptomatic in terms of abdominal pain, back pain, urinary incontinence, and inability to use, to exercise and use their abdominal wall muscles properly. Traditionally, they used to repair these kind of conditions with open surgery, the so-called tummy tuck procedure, which is quite an invasive procedure. But nowadays, in appropriately selected patients, we can perform these procedures through keyhole surgery, laparoscopic surgery, which typically involves 3 small incisions in the low part of the beginning line. And we can get access to the posterior aspect of the muscles. We can get together the muscles, and then we can reinforce also if needed, or if this is a choice of the patients and the doctor, with an abdominal wall mesh. I mean, the benefit of laparoscopic approach for repair of the divarication or diastasis, I think it's really massive, because it only involves 3 small incisions, typically in the lower part of the abdomen, in the bikini line, instead of a major abdominal wall incision from one end to the other end of the tummy. It can even be performed as a day surgery procedure. It's fairly painless. The recovery is very straightforward. We can also use a mesh that we can put outside the abdomen but underneath the muscles, which means that is not going to be any sort of disruption of the abdominal wall integrity to the patient, to reinforce the abdominal wall. So basically, laparoscopic repair is a much less invasive repair. The cosmetic result is much better, and it provides a much better reinforcement of the abdominal wall and more sustainable and durable results in the long term. I would say that laparoscopic repair of the rectus muscle divarication is a very safe and effective approach. There are some risks in terms of residual or recurrent or recurrence of the divarication in the long term. There's also the typical risks of bleeding and infections that can come with any type of these repairs, but they tend to be quite lower compared to the open tummy tuck approach. And most of them, they can be managed relatively easily in a very straightforward way. For me, the ideal candidate for a laparoscopic repair of rectus muscle divarication is a patient that has a severe degree of this condition. He's symptomatic, or this condition for him constitutes a significant cosmetic and functional burden to his life. And typically, these are the patients that they don't have significant amount of excess skin into the lower abdomen, so that means we don't have to perform any skin removal. They tend to be typically young patients, female patients after multiple pregnancies, that they don't have central obesity, they don't have much of excess skin, and it's a purely issue with divarication, which is quite obvious, and it does basically it is a cosmetic problem for the patients, and also a functional problem. So for me, this type of patients, they're ideal. They can avoid big incisions or the invasiveness of a tummy tuck procedure, with a very straightforward recovery post-op and very good and sustainable results. Typically, the patients with the laparoscopic divarication repair, they will stay overnight in the hospital. In selected patients, they can be even done as a day surgery procedure. They will take normal painkillers for a few days up to a week. We will encourage the patients to be as active as possible from day one. I will say the first few weeks, the patients, they will feel some sort of bruising into the abdominal wall because of the dissection that involves and the placement of the mesh or the repair of the divarication. But after 2 weeks, progressively, they can restart the regular activities, and the recovery is quite straightforward. I will advise my patients to avoid any strain in heavy lifting and high impact activities, typically for 4 weeks after the operation, and after that, they can go back to all of the regular activities without any restrictions whatsoever. Obviously, the cost of these operations, they vary depending on the patient's circumstances, on previous operations, and also logistics in terms of the different hospitals. And the cost, I would say, is pretty much the same as a normal abdominoplasty or a tummy tuck procedure.